So we can start with our first candidate. We'll start calling. I'll call the first and second one. Okay, so Dr. Vagish Tripathi, the opening batsman. An interesting case of malaria retinopathy mimicking as viral retinitis. So the next candidate can just be waiting here, Dr. Akshi Sharma, so that we don't waste time in coming and going. All right, please.
Good evening, everyone. I'm going to present an interesting case of malaria retinopathy mimicking as viral retinitis. 41-year-old male farmer by occupation presented to us with chief complaint of fever for 10 days and diminution of vision in both the eyes for 10 days. According to the patient, he was apparently asymptomatic 10 days back when he noticed sudden painless diminution of vision in both the eyes, and there was no improvement in his vision, so he continued his work and presented to our hospital for an eye checkup. On questioning, he told us about the treatment for fever, which was associated with chills and rigor, but no documentation for the same was available. No significant history of past illness. He was treated for fever with tablet acyclovir 800 milligram 5 times a day for 7 days, for which he showed us the strip, and there's no significant family history. He is vegetarian with normal bowel and bladder function, non-smoker or tobacco chewer, non-alcoholic. He is very well oriented to time, place, and person. Pulse rate was 86 beats per minute. Blood pressure was 130 by 78 millimeter of mercury, and respiratory rate was 16 breaths per minute with no pallor, icterus, cyanosis, clubbing, lymphadenopathy, or pedal edema. The head posture was straight with eyebrows at normal level and position. The orbit's margin was palpable, continuous, well-defined, non-tender with no crepitus. The lacrimal apparatus showed no abnormality. Rho plus was negative. Extraocular movements were painless, full and free in all 9 cases. IOP measured at 10:27 a.m. by Goldman applanation tonometry. In the right eye was 9 mmHg, and in the left eye it was 10 mmHg. The right eye uncorrected vision was 460, which improved with pinhole to 560 on his first visit, which after the treatment improved to 624 partial, not improving with the pinhole. And the left eye 618 partial, which improved with pinhole to 612, and on after the treatment it improved to 69. The anterior segment examination was unremarkable with media clear, disc with normal in size, round, pink, Syria 0.3:1, healthy neuroretinal rim, vessels were normal with background showing cotton wool spots, hemorrhages, Roth spots, and retinal necrosis threatening the macula. So provisional diagnosis of post-fever retinitis or the viral retinitis was made, and several investigations were advised, which included the complete blood count with peripheral blood smear, erythrocyte sedimentation rate, random blood sugar, Montu test, chikungunya, and he was called to review with reports. The blood investigations showed normal except for the ESR, which was 50 millimeter of mercury in the first hour with Winthrop, and hemoglobin of 11 gram percent. He was positive for Plasmodium vivax band. So based on this, our diagnosis was revised to malaria retinopathy, and treatment was given with tablet prednisolone 60 milligram 1 OD for 7-day tapering, tablet pantoprazole 40 milligram once a day for 28 days, tablet calcium 100 milligram 2 times a day for 28 days, and tablet chloroquine 1000 mg stat followed by 500 milligram at 6, 24, and 48 hours. So after the treatment, the fundus picture improved. Thank you.
Okay, thank you. So you did viral markers also? Because in this case, as you said, it could be malaria, it could also be viral also. And you stopped after 1 week of antivirals, you stopped antivirals?
Antiviral, he was already on the antivirus. So when he presented, there was no improvement in the vision. So it was revised after the investigation. It was revised to malaria retinopathy.
So antivirals were stopped?
Yeah.
Okay. Because how long did he have his antiviral therapy? Because he was
1 week.
1 week.
Hmm.
Okay. because it could still be a viral retinitis.
Was the wheel Felix test done?
No, sir.
Because in such a scenario, I think that also becomes a DD, though lower down.
Okay, sir.
So do we recommend stopping the antivirals altogether? Wouldn't have been, should have continued with the antivirals and done the test and then changed the drug? Because 1 week is probably too short a time, right?
Yeah. So he was on the antiviral from another doctor. When he presented to us, he already stopped that medication, and he only showed the empty strip. So what we did, we asked him to come with the investigation on the next day. So following day, he presented with the investigation where malaria retinopathy was
But
there.
the first diagnosis was viral only.
Yeah, first diagnosis was viral.
Changed it.
Yeah, we changed it later after the investigation.
Yeah, thank you for your presentation.
Thank